Hi everyone, welcome back to my channel. In this video, I have a special guest for you who can help you to understand much more about your lower back injury. Patel is an online client who lives in USA, and she was suffering from lumbar disc extrusion, and she contacted me 12 weeks ago and we started her recovery plan. And in this video, we are not going to only cover her recovery and how she's getting on so far, because she has progressed a lot and she's back in the gym training, technically pain-free. But beside that, Patel, she's a nurse who works in a hospital over there in USA, and she works in an MRI center, which can be hugely beneficial for you to get her perspective of what she sees in a day-to-day living while she's working. And beside that, she discussed about management of lumbar disc bulge, herniation, and extrusion. If you are suffering from lower back pain due to disc bulges, herniation, or extrusion, I believe this video can be hugely helpful for you, because she does share her experience in her recovery and also add on some information from her perspective as being a nurse and working in hospital and seeing a lot of patients with similar injuries. Beside that, she shared a couple of tips at the end of this video that I think can be hugely beneficial for you. I personally added a series of exercises that she's been doing in her rehab plan at the end of this video that I think it can be hugely beneficial for you in regards to your recovery. If you're suffering from disc bulges, if you're suffering from disc herniation or extrusion, and you're experiencing sciatica symptoms or sciatica pain, in this video you can literally do certain exercises that can help you with your pain and symptoms. Make sure to watch the video until the end and follow the tips. And if you have any question, you can leave me a comment.
I suppose I would like you to just share your own story, because you working in healthcare, you know what I mean? You have a little bit different, I suppose, perspective of, overall injuries, because you work in a hospital, and you came to me with your own injury and we started your rehab plan like a while ago. In that perspective, I suppose you can share with people what was the injury, how come you came to me, and what you're doing so far. And we're going to go through more questions, because you work in not only in hospital, you work in, I suppose, MRI center, right?
Yes.
Yeah, which means you see a lot of MRI day to day, which is more fascinate me in regards to, like, okay, the data that you have there in comparison to my average patient, Okay. Maybe you just start with your own way. How did you start your routine, and what happened initially about your injury, etc.? Would that be fair?
Yeah. So I injured my back first time working at the hospital, moving a patient. It was in 2020, and I had a little bit of bulge. Working, doing physio, it got better. And then after having a baby, I injured it again last year, 2022. And I did a physio again, it got better, but I didn't do my exercise routine every time. And I had a C-section.
Okay.
So everything was not that good. So while working again with the baby, sitting for long periods of time with my baby, I think it went bad, and I had a small extrusion. So I did a physiotherapy. I work in MRI. So I had an MRI done one time, and then I found that, okay, I have a big extrusion now. I didn't have no bad symptoms, but I see a lot of patients. So I was like concerned. I'm like, okay, I need to fix this. So I did physio here, did spinal decompression, couple of sessions. I don't know if it helped or not, but I don't know.
Yeah.
With the physiotherapy here, they gave me a routine, but it was just very basic routine. So I was doing those, but I still had a pain. But, basic routine, once your body is used to, you need to introduce something else.
Exactly.
Which I was like, here you do 6-week sessions and you're done.
I got you.
And then every time I look online, I see Bob.
Yeah.
So I was hesitated. First of all, it's an online sessions, there's so much frauds and everything going on. So I was
Of
very
course.
hesitated. Went on your website 3, 4 times to enroll it, and I'm like, do I do it? No, yes, no, yes, no. And then finally I was like, okay, let's just make out I made a decision. I'm like, I'm just gonna do it.
Yeah.
And I'm glad I did it. So now with your routine and your workout, I have paid, but it's very less. It's getting
Mhm.
better, I feel.
I got you. I got you. All right. You kind of like went through the story very fast. I just want to go back maybe, which is good. I'm gonna go back. Okay, then technically, while you work in hospital, you got injured initially, and you do
Yes.
have access to MRI scans, obviously, and you can get the
Mhm.
scan pretty quick and get results and see what's going on there. Which means initially you
Yeah.
got a scan and it shows it was a bulge. You went through some physio
Yeah.
rehab stuff, and it got better and it
Mhm.
felt good. And then you got another incident, in the
Yeah.
hospital again, and it was
Yeah.
kind of like got sore again, and you got rehab, etc. But after your pregnancy was totally a different game. It was
Yeah.
much more, I suppose, the symptoms was much worse.
Yeah. Because it was my C-section baby. So,
Mhm.
your core is not that strong anymore.
I
And
got you.
I did work out, but I didn't do consistently because my baby was little
Got
and
you.
I couldn't go to gym every day. And with
Hmm.
work and baby, I couldn't work out either at home that much.
I got you. I got you.
So that didn't help. So, and that's why I think I injured with my baby, sitting for the baby, feeding
Hmm.
them for a long period of time, and then working. So all that made it worse.
Got you. Okay. And then we kind of like start your plan. Like, I mean, we did the initial consultation. Maybe, but I'll just share with people, like, what was your input, like, in regards to, like, what was your thought after the initial consultation? Because you coming from a medical perspective, you do have knowledge of things in the hospital,
Mhm.
people there, they explain things to you in regards to your injury and back and etc. Um,
Like in the physiotherapy, they told me not to bend forward, not to, do any kind of bending forward exercises.
mhm.
So I think when I started your plan, I remember you had like those deep squats,
Yes.
and I was like, do I do those? Is it gonna
Yeah.
make it worse?
Yeah.
And you were like, no, it's gonna be fine. Just go slow and just do
It's
it.
your
If you
body.
feel anything bad, know. And I
Yeah.
did it, and I got better day by day. So I had a fear of not doing stuff because that's what they told me, that bending forward, doing, twisting your back would make it
I got you.
worse. But I think
Absolutely.
your plan was like go consistently, but little at a step. So that helped me.
Exactly. And in regards to kind of like, I suppose, the depths of exercises routine that you follow in the routine, do you think, like, I mean, there's something that people constantly ask me, Bob, advise me on this MRI. They send me MRI scan and they tell me, advise me on what should I do to help me, as quick as possible. And there's a myth there that people think I have some magical power, or, a magical routine, honestly, and they constantly
Yeah.
thinking that I don't tell them, what to do. But
I,
did you find any of the exercise very particular, or anything that is magical and solve the problems immediately?
no, you have to be consistent. You have to exercise every day, no matter what. Just if you want to get better, you have to. That's what I did, and that's what helped me. Yes, I'm like that too. I do a lot of MRIs on a patients, and I see a lot of bad MRIs.
Yeah,
So whenever I see bad MRIs, my back hurts too. But
yeah, yeah.
at the end of the day, like every patient is different, and all symptoms are different. And like everybody says, even the doctor says, don't, even my radiologist told me one time,
Mm,
don't treat your MRI, treat your symptoms.
exactly.
So you exercise consistently, you will get better.
Yeah, which means
And
technically
you're positive. I like it.
Yeah, thank
You were
you.
so
Thank you.
positive. Every time I will be like, okay, Bob, I had a back at MRI and now my back is hurting. You'd be like, no, you're fine.
Yeah,
So
yeah, yeah. I think
yeah.
that is so true and so important to highlight that we're talking about movement in overall, which means movement
Yeah.
is key factor for recovery. And if you can
Mm-hmm.
link those movements to your personal goal, which means if you want to simply be active, or if you want to be a person who can walk, I don't know, 3 miles a day, your exercise can be
Mm-hmm.
customized based on that. But again, those exercises are
Yeah.
not necessarily a magic routine that fix things. They're
No,
movements and basic movements. We try to,
you have to do it.
yeah, simplifying, those exercises. If I give you example, I try to share some of those exercises that you're following at the end of this video for
Mm-hmm.
people as well to get a perspective of okay what they can follow, but there's nothing special about them. But the fact is that when you follow it as a routine, you get the benefit of
Mm-hmm.
okay having a projection of okay these are the things that I've done for the last 2-3 weeks and I feel good. I probably can do maybe some other stuff or maybe a little bit more repetition and build up my strength and endurance. But
Yeah.
that's so true. But the second thing that you mentioned is the consistency, which means you have to be consistent with them. Otherwise, you're not going to see overnight results. That is so true. And one thing that I suppose, I mean, you've been working with me for like 4 months, but one thing that I see with my patient, like who's much longer training with me, you know what I mean, is that we have data right now that support that the sciatica symptoms, that you get through lumbar disc bulge or herniation can last up to 15 months. You know what I mean?
Mm-hmm.
Which means
Yeah.
like what you see on internet or sometimes what I try to show my patient, the average recovery time is usually 12 weeks. That's what we know. We have data of that,
Mm-hmm.
but that's a very generalized, you know what I mean, a number, and not everybody has exact same duration. And
Yes.
and if you do not get better after 12 weeks and you still have some symptoms, it does not mean that it's not working, you know what I mean, or your body not responding. You could
Mm-hmm.
probably just a little bit more time. As simple as that.
Uh,
Yeah, and we do have those data, which is fascinating because it is true. I do have
yeah.
a very variety of patient-based recovery, but I mean, not everybody takes 15 months. But I do have actually at the moment one patient who is like his symptoms actually improved a lot. Like he's like let's say out of 10 is one, yeah, but he still feels some symptoms, or two, let's say, but that's kind of like a rate that you can say. Now, Patel, beside the exercises, I suppose you still working as well, right?
Yeah.
I think we discussed a lot about okay, what you can modify in work, what can you do, what you shouldn't do. One of the things in your job is that manual therapy is a huge thing, right? Which means you move
Mm-hmm.
people, etc. And I think one part of your plan was, as we discussed earlier as well today, is that to get you stronger in pulling and pushing things, technically,
Yeah.
because that's something that you do with patients.
Yeah.
Did you find like having a kind of customized plan that kind of like fulfill your kind of like day-to-day purpose of living, and like you talk about like recently, okay, I want to do a HIIT class, we're gonna move on towards HIIT classes because sometimes people think, okay, if I have a back pain, I never can do intense activities anymore, but the
Mm-hmm.
reality is that if you build your body again and if you move on gradually, you can. And the fact is that nothing can stop the back to reherniate, you know what I mean? Or
Yes.
see another bulge, you know what I mean? We can't really predict, okay, this is going to help you and you're going to be fine, But the fact is that if you stay fitter and stronger, well, we know that your body adapt to that bulge or extrusion.
Yeah.
And we have some data that we can correlate to that.
Mm-hmm.
How did you find that routine?
No, I like the routine because before I went to physiotherapy here, they gave me a routine, but there was just a regular exercises. And then after 6 weeks, I'm like, okay, now what I need to do? If I
Mm-hmm.
want to lift weights, okay, which one would be better so that I won't re-injured it? So your routine did help me that okay, I know what days I have to do which exercise, how many reps, and how many times. So I feel like, okay, I was not overdoing it. And you sending you those videos where like, okay, if any of my technique is wrong, you will let me
Yep.
know. So that helped me that, okay, if I'm doing anything wrong, you'll let me know.
Yeah.
So I liked it that you had a plan that, okay, on Monday you do this, Tuesday you do this, Wednesday you do this. So
Got you.
that
Got you.
so I don't have to think, okay, today which workout do I do?
I got you. Yeah, which means a bit of clarity about exactly what you do,
Yes.
how to do it, and getting a bit of coaching from the side.
Yes.
If you're doing exercise right, in technique wise, etc. Which is I feel like it's really helpful for individual feedback, because everybody does move differently. That's great. Okay. Patel, in like one of the biggest question that I have, like because you do have some data that a lot of people do not have access to it, because I suppose you work in a hospital, you work in an MRI center, like people that you see there who comes for, I suppose, MRI of back, we talk about spine, neck, lower back, mostly lower back. Like what are the chances of you see bulges or abnormality in their MRI scan?
A lot. I think most of the patients have bulges.
Yeah.
I'm like, if I do a 10 patient out of 10, 8 would have bulges. And with that teeny tiny bulge, they have really bad symptoms. And then here I'm thinking, oh, I have an extrusion.
Yeah. Exactly.
So,
Mentally,
yeah.
that can really, really freak you out, right?
Yes, it can.
But that's fascinating, and I think I suppose like MRI shows what's going on there, but it does not shows okay how long it's been there, right?
No,
That's
it is.
one of the error of I mean it's not an error, but that's the myth that we can't really say okay, if you see a bulge in your MRI, it's the correlation with your latest injury that you have right now. And if you have a sore back, it doesn't mean that okay, you bulged yesterday and
You have bulge.
exactly, yeah. But when you say let's say 8 out of 10, and usually what's the procedure that people do there? Like like let's say if they are getting let's say a scan and they have a bulge or let's say herniation or protrusion or extrusion, whatever, and what is the procedure that they do usually?
I think most of them would go for a rehab physiotherapy, but then if they tried that, did other whatever non those therapies, if not, then they'll just go for surgery.
I got you. And when you say surgery, what is the common things that they do? Like what is the common procedure that
Here,
they do?
I think you do the laminectomy and then discectomy.
Yeah, like microdiscectomy, basically.
Yes,
Yeah,
microdiscectomy. I
yeah,
have
and
seen a lot of patients who have went through microdiscectomy and within a week their legs not working, they
yeah,
cannot feel their legs. So it's not, and they are young patients
I got you.
and have bad discus extrusions, and they went for a microdiscectomy and they're still coming back for MRIs because they're still hurting.
Yeah. Exactly. Which means that like
So
literally like surgery can be an option, but is not necessarily sometimes the quickest, I suppose,
yeah,
recovery plan.
yeah.
Or
And once you open your back, be ready to open
yeah,
it again.
yeah.
So it's like once you cut your back, you might have to do it again because, back surgeries are very crucial. You need to have really, really good surgeon to work on it.
I got you.
And nerves, while getting your disc out, if they injured your nerve, then you have a permanent damage right there. So if you have to think for surgery, get all your options out
Got you.
first and
I
then
got you.
go for
Like,
surgery.
like the purpose that we're going through this question, just to clear this with people watching this video, is not about like discrimination of surgery. Some people definitely need surgery and urgent
No,
care.
yeah, yes,
Absolutely. And
yes.
I mean, we're just going through just a review of your perspective of what you see commonly, but it's an advice that I always tell my patient as well, like who actually needs surgery in regards to, let's say, lumbar and disc bulge, herniation, or extrusion, etc. Because a lot of people can have a very severe symptoms. You know what I mean? But
Yes.
but
Yes. They need it. They need it. Yeah.
yeah,
I
but
have seen
yeah,
patients who come through ER, they
yeah,
have bad extrusion, and they lost their bowel movement, and they have to go for emergent surgery, and
I
you
got you.
cannot
Yeah.
take. Then you need it. You need it.
But that's one of the sign of the Cauda syndrome, which means like,
Yeah.
they have a severe compression of the spinal cord, and that
Yeah.
can kind of like cause some dysfunction, such as a bowel a movement dysfunction, or foot drop, or total
Mhm.
numbness, or lack of strength in one side or both side, and technically, it can affect their, I suppose, sexual function, etc., which is patient might not necessarily kind of know all of those symptoms by hand. You know what I mean? But these are the things that we screen with patient immediately, and you have to really be fast in that time, because those symptoms can be sometimes permanent damage. But that's very fair. Now, Patel, like, I mean, I suppose what you mentioned here is very important for people to know, that okay, surgery is always an option, but the first thing that probably people has to do before jumping to it, first of all, like, not judging the MRI by what its look. Second, get I suppose a second opinion. You know what I mean?
Mhm.
If they told, okay, let's say if you have to do surgery or any type of procedure, and third is that try physio, something non-invasive initially
Mhm.
before you do anything else. And if I look at it here, like, we do have some data in regards to like reherniation after microsectomy. Like, would that be something that you see in the hospital? Like that happen?
Yes, I have seen a lot of patients that had a microdiscectomy, and after a couple of years, they still have back problems and
Uh-huh.
have rehab. Yeah, they do.
And I suppose, do you think would they go again for another surgery? It's
I don't,
tricky. Yeah, yeah, it's a
they
tricky
don't
one.
want to, but I
Yeah,
don't. I have patients that they have been there. They have worked on their back for maybe 5, 6 times, and now they're like, okay, I'm done. I don't want them to work on my back anymore. It's
got
fine.
you.
How it is, it's fine. So
Yeah.
it depends on how tolerant you are and how bad it is. But yes, I have seen patients after surgery and having reherniations.
I got you. I got you. Which means it is possibility that it reherniated again as well. I mean,
Yes.
it doesn't mean that's going to be sore or cause symptoms, etc., but it can be possible. Which means if you
Yes.
want to do microcystectomy, you want to really look at, okay, what are the chances of
Mhm.
reherniation, or it had other I suppose side effects, like such as infection. You know what I mean? Or I suppose nerve damage, etc. But Patel, one of the questions that I wanted to ask you is that I think you have access to MRI, and you decided to do another MRI scan
Mhm.
after, like, I mean, 4 months of rehab together, and I suppose you did um, 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 another MRI,
Mhm.
and what was the results? Maybe you just share that. Because in reality, I think you were expecting that, okay, I can see some changes, and we can see, I can say you can see some changes in your MRI scan.
Yes.
But what was it like? How did you feel about it?
I feel that I was happy that it didn't got worse with all the
Yeah,
workup and everything. So I was happy with that. That it
yeah,
okay with doing all this different kind of workouts, it did not got worse. You see some little minor changes, but I was like,
exactly.
okay, if you see it, okay.
Yeah, but I
So
mean,
I I'm happy with that. Whatever I'm doing right now, I did not do that before I started your program. So
absolutely.
after your program, doing all these different workouts, and yes, I still have that extrusion, but my symptoms are better. So I'm
Yeah,
happy with it.
yeah. Which means one of
So
the things.
I used to think first that okay, why my disc is not going in, or like why?
Yeah,
But now now, since my symptoms are getting better and I'm doing more stuff with this last MRI, I was like, oh, it's fine. If it's still there, maybe it might take a little bit longer,
I'll
but
get
at
you.
least I'm doing different workouts now that I was
Absolutely.
not able to do it before.
100%. And one thing that I think, it comes out of that whole, I suppose, a second MRI is that I just want to share this with people because you can't really rely on just on your MRI and your symptoms, which means not always MRI does basically promote a very severe symptoms, and one of the things that we see commonly and that your nerve adapt to that bulge or extrusion or protrusion, which is a beauty of the body, which is like literally adaptation happen anywhere, especially even in your spine. And one thing is that the bigger is the bulge is, it does not mean actually is worse. And commonly, people who has bigger extrusion, they have a quicker recovery, which is fascinating.
That's what I tell myself. It's gonna be quicker recovery.
Yeah, you have to be
maybe
positive
it'll
about
take
it.
a little bit longer, but it's gonna be recovered.
It doesn't matter as long as one of the things that you're functional, you're active, you are doing your daily routine, you're improving your, I suppose, fear, because I think initially you had a lot of fear in regards to movement and exercises. And that has changed a lot physically and mentally. You have more trust about your back, and that's, I think, is priceless in my perspective. Patel, thank you so much for your time. There's a lot of good information in this video that I think people can get advantages. Is there anything else that you'd like to share with people that we didn't discuss so far?
Yes, if you're
As a tip.
suffering from
Yeah.
back pain and you're like me, okay, what to do, what workouts to do, is my routine on, contact Bob, he'll help you.
You're very kind.
And if you
Thank
work
you.
out consistently, then it will help you. But you have to work out. You have to work on your back.
Consistency. And you have to trust the
Consistency is the key.
Yeah, trust the process.
Yes.
That's another thing. Yeah.
Yes.
Any other tips there, Patel? Anything else that you think that helped you the most?
I did work out every single day. Doesn't matter what day, what time. I did took time out of my busy schedule and try to do the workout, drink plenty of water, and eat healthy. So yeah.
Very good. Which means just take care of yourself. Which means improve your overall lifestyle. And if you need to eat better, sleep better, and reduce your stress, all those kind of jazz. That's amazing. Patel, thank you so much again for your time.
Thank you.
We will hopefully share more information of your recovery in future with people. But I believe this video can help a lot of people who get information. And you're, I suppose, can be one of the best person who describe, okay, what's going on with MRIs, you know what I mean, and how much you can really rely on them, you know what I mean. Amazing.
Yes.
Thanks again for your time.
Thank you.
I appreciate your help. Cheers.
Oh.
All right, guys, I'm going to share with you 6 exercises that Patel has been following for the last 12 weeks, and she's been getting great results with following these exercises daily in her routine. We're going to start with cat camel, which is simply mobilize your upper and lower back. For cat camel, you're going to put your hands underneath of your shoulder, your knees underneath of the hip. We basically extend and flex the lumbar spine. In a very acute phase of your injury, this movement can be a little bit tricky to get it, but you try to gradually move within the comfortable range that feels good. A little bit of soreness, that's totally fine, but you don't want to poke your nervous system and aggravate your symptoms. You're going to practice this exercise for 3 sets of 8 to 12 repetitions. Breathing is essential while you're doing this movement. Make sure that you're not tensing and holding your breath. Try this exercise for 3 sets of 8 to 10, 2 to 3 times through the day. The following move that we're going to do, guys, is going to be hip opener. We call it hip 90-90. This movement helps you to internally and externally rotate your hip. You can do this in bed or on the ground with the help of mat. You can cushion the ground. If you find it is difficult, you can even do it seated. Now, I'm going to show you in a basically a very kind of like moderate movement to advance, which means you start with just bringing the knee to either side, feet shoulder width apart. You're using your hands to support your back basically. and you can bring your foot a little bit more forward and just a partial range. You start with this. You don't hold them either side. You're just playing around with it. Now, this movement helps you to slowly build up movement around your hip. And when you felt feels more comfortable, you can widen your feet and try to go to a wider range of hip rotation. See, now you internally rotate your right and externally rotating the left. Now we're going to go all the way. It might take you a week or two to get to this range. Don't rush it. Breathe in and out. And you're trying to practice this move for 3 sets of 8 to 10 repetitions. Work around your own range. Don't force it, and build up movement gradually. The following move that we're going to basically progress to is going to be thoracic rotation. Rotation can be a very difficult movement when you're suffering from lumbar disc bulges, because your muscle around your lumbar spine and your mid back become very protective, and by a small amount of rotation you can get a spasm. Now, before you get to that zone of too much protection, you want to stimulate those muscles and gradually use them, and by doing that you're reducing the chances of getting a spasm. We can't really prevent them, but you can reduce the chances. Now I'm going to show you how to do the rotation and gradually build up this movement. We're going to be in a kneeling position similar to cat camel. You want to bring one hand here around the neck, and technically this arm does not move, is stable, and you are not shifting back and forward. You want to stay stable. You want to bring this knee and this elbow inside between your knees and your other arms. Hold it there for a few seconds, and then you don't want to lean back or forward. You just want to turn and look at the ceiling. You want to go within the range that's comfortable. As you can see, I don't have that much range. It's not a huge range, but I can feel the tension in my mid and lower back. I'm going to show you from the other side. Your neck, guys, don't really pull the neck. Just you're holding the hands here. Your neck does not do anything. Bring it in. Then you open it up. Breathe in and out. Excellent. Now, this movement should be done within comfortable range. Practice it for 3 sets of, let's say, 5 each side, 2 to 3 times through the day. And gradually, when you try to do this, it becomes much easier. The next movement that we're going to do in this routine is going to be back extension. Back extension can be done in so many different ways. I'm going to show you the seated way that you can sit on a chair or on the floor, and you can gradually progress them to the basically groundwork. Initially, we're trying to get that extension movement to the back. Use your hands, try to get a bit of push there, slow down. Now, if this is not comfortable, you can do it in a kneeling position or in this position, which means you want to relax, push up. For people who can't really sit down on the ground, this can be a really good modification. All the way up, breathe in and out, slow down. Within range that feels comfortable, guys. You're not forcing any movement. You do 5 to 8 repetitions, 2 to 3 times. Now, when you got comfortable with this, or if you find it is not really comfortable, you can do it in bed, in a prone position, which means you're going to lie on the belly, hands next to your armpit. Don't hold your hands too wide, it's closed, yeah? And initial phase can be just, you stay there for 10 seconds, and then you go down. When you got more comfortable, you can come back up slightly, hold it there for 10 seconds, and slow down. Come back up again, and slow down. It might be slightly uncomfortable when you're doing it initially, but one of the most important things about back extension, guys, is as you do it more, it should feel more comfortable. If it's not feeling good comfortable or it gets worse, do not force it. Maybe give your body a few days and practice it again. When you find some movement does not feel good, don't force it. Take it easy for a few days, try it another day, maybe for 1 or 2 sets. Your body needs sometimes a bit of break to adjust to that movement, and you can try it again. We're going to move on to a core exercise routine that can be beneficial if you're suffering from lumbar disc bulges, which is kind of like static, which means you're not really moving too much, and it can happen, and you can apply this exercise in a very early acute phase. We talking about high plank, which means there are different levels that you can start from. A very kind of like a wider aspect, which means your knees are straight, your hands underneath of your shoulder, you're on your toes, and your back is not sinking. Watch that, or is not too high, which means you're trying to create a bit of tension and control in the core while you're doing this. Now, if you've never done high plank before, you can start with a very basic things that you can create a smaller kind of like circle here and try to just come up on your toes. 5 seconds, come down. Same thing, your back is not sinking, it's not too high, it's in neutral position. Come up. 4, 3, 2, 1, and relax. When you got much more comfortable with it, then you can make more space and bring your legs more back. The more straight the legs are, it can become much more challenging. High plank is a great core activation muscle and basic exercise that you can gradually build it up, and you want to challenge it between 5 to maybe 15 to 20 seconds. The last exercise that I'm going to share with you guys in this routine is going to be posterior pelvic tilt. When you're suffering from lumbar disc bulges or you have sciatica symptoms, the muscle around the lumbar spine can be very protective and tight, and that minimizes the posterior movement of your pelvis. And by not getting that movement, you become conditioned to that posture position, and you always try to keep yourself straight, and you never get a chance to actually relax those muscles. Now, that coordination and movement is hugely important for your recovery. I'll repeat this exercise in many of my videos, but I really want you to pay attention to this movement. If you practice this exercise, we do have studies and paper who literally talk about the same movement that help people with recovery. I'm going to show you how to do it. You can give it a try. You're going to lie down on your back. To just show you from this angle, if you think about your lower back, you have a space here in lower back that can be sometimes filled up with your lower back, but you can literally create that space with arching your lower back, and my hand can go now in. There's a space there, like a tunnel. Now, this tunnel can be filled up again with my back if I tilt my pelvis to posterior tilt, which means rotate it backward. Now I can feel that pressure, I can hold it there for 5 seconds, but sometimes you do not get the same coordination and movement as I have. Now you want to practice that, which means you're going to hold one hand underneath of your lower back. There are 2 steps in this exercise. The first step is to arch your lower back, which means there's a space here now. I can feel the space. The second step is to fill the gap with your lower back. Hold it there. Breathe in and out. And 5 seconds, and then relax it again. You relax it. You go back to the arch position. Now you push it back again. Hold it there. You want to really feel that pressure on your hand. After a while, when you practice this movement, you don't need to hold your hands there. You already feel the movement, but I can guarantee you a lot of you will struggle with this movement. But the more you practice, you focus on your breathing, you will improve. Make sure that you're breathing and you're not holding your breath while you're doing it. Thank you for watching this video, guys. I hope you guys find this video helpful. If you're suffering from lumbar disc bulges, disc herniation, or extrusion, as you can see, you can recover with conservative treatment, and you do have a chance to start your rehab plan right away. I believe many of you guys has been getting suggestion from your, I suppose, the orthopedic or your consultant that you need surgery. But one of the things that is very important, that surgery has its own time, and I suppose many of you guys can evaluate your basically options and see what would be the best option for you in regards to your recovery. Recovery is possible through a conservative treatment, and I believe every single person who has lumbar disc bulges or herniation or extrusion, they do have a chance to recover within a perspective of, okay, if you do not have those coracoidal syndromes or something really sinister, you do have a chance to recover with conservative treatment. If you never try your options, you never know. I'll help people globally all around the world through online consultation and help them to get clarity about their injury, have a routine and follow a customized plan that can help them for their recovery. And you can see a couple of testimonial and video that I have in my YouTube channel. I'll leave a link for you here. You can take a look and see if that's something that you would be interested to get started. You can always contact me through my website or book an online consultation with the link below. If you have any other question, you can always leave me comments. Don't forget to press that like button, subscribe my channel, and share this video with your friends and family. I really appreciate your help. Until next week, all the best.